Hi, and welcome to the Psych, Health and Safety podcast. My name is Jason Van Schie, and I'm one of the hosts of the show. The aim of the podcast is to rapidly increase the knowledge and application of psychological health and safety in workplaces worldwide. To help with this, we have regular guests from around the world who are leading the way in this important area. Before I introduce our guest and topic for today, though, allow me to introduce my co-host, Joelle Mitchell. How are you today, Joelle?
Hump day, Jason.
Hump day, Wednesday, yes. 2 more days till the weekend. So we are recording on a Wednesday afternoon to make sure that we align with our guests' time zone.
It's a much friendlier time zone for us today.
Yes, we've got some rough ones coming up though. But today's nice. Not so nice for our guest, who's definitely made some accommodations for us. So thank you for that. But yeah, no, we've got a very interesting chat for today.
Yes, looking forward to it.
Okay, well, we should probably get into it then.
Let's do that.
So I'd now like to introduce our guest for today. She's a German who I first met when she was working in Australia, who now resides in London. She's a long-time proponent of the role of workplaces in facilitating positive health outcomes. And she's currently working as the head of global health and wellbeing programs at Generali Employee Benefits. Welcome to the podcast, Daniela Masters.
Thank you, Jason and Jel. I'm super happy to be here. Thanks for the invitation.
Hey, thanks so much for joining us. You're a big get. We wanted to have you on the podcast for some time, and we finally got the stars to align for us.
Thank you very much for those flowers. I'll take them.
No, you're very welcome, and thanks. I know we're going to have a great chat today.
All right. So before we get into the serious stuff, tell us, what are your favorite podcasts?
Well, Jel, I can honestly say that yours probably has been the one that I listened to the most in the last few weeks. But I also have to say that I'm not a big podcast listener. But that aside, I think I'm someone who always used to read a lot, and podcasts have been something that I occasionally listen to, maybe during travel. But I'm a bit more like a topic and guest focused listener rather than like a podcast dedicated listener of one podcast. But if I had to call out a couple, then it's probably I'm a yoga practitioner, so I do listen on a personal level to some yoga podcasts like Yogaland, for example, or any podcasts which promote mindful, sober, curious, and overall healthy living podcasts. So Magic Lessons by Elizabeth Gilbert or Brené Brown's Unlocking Us, Super Soul Conversations, things like that. But I'm looking forward to your other guest recommendations. Maybe I get some inspiration.
There's definitely been some interesting ones in there. So yeah, I've picked up a couple from the guests. So yeah, do have a listen because they do have some interesting ideas. All right, let's hear about your professional career then. Tell us all about that.
Okay, so as Jason said, born and raised in Germany, where I did a master's in sports science, economics, and English. And while I was still at uni, I started working as a corporate marketing and sales manager for a local gym chain. And that was the first time I kind of dipped my toes into the world of corporate health. And back then, that kind of meant fitness classes in office, reduced monthly gym rates for employees, or organizing health days, health fairs, and stress management trainings in companies. So we've obviously moved on from this quite significantly, and the understanding of corporate health has become a lot more holistic, which is absolutely fabulous. From there, I changed onto the client side, if you want to say so, and worked for a large-scale food delivery service in Germany, which had 21 distribution centers across the country. So the company was delivering big items, like bulky, heavy items for hospitality, nursing homes, hospitals. And I was responsible to create their national health and wellbeing strategy and roll out the program across all centers. So it was a very interesting workforce from white to blue collar, with challenging factors such as shift work, no access to computers, excuse me, and largely male dominated, where we do know that the adoption for those programs is a little bit lower than in other areas. In 2013, I moved to Australia. And I started to work for an employee assistance program provider. So I was diving deeper into the mental health space in the corporate world. I was a relationship manager and well-being specialist for New South Wales and ACT. I work with companies from remote male-dominated natural resources companies to city center advertising agencies. So very diverse needs, very diverse adoption and utilization of mental health support services, and very diverse cultures. All of these are influencing the success of an employee assistance program. From there, I moved on to a large private medical insurer in Australia. There's not a lot of them, so you may guess which one it was, which is where I met you, Jason, through the partnership with your company, People Diagnostics. I was working in their corporate health and wellbeing team and was responsible for New South Wales and Queensland as a corporate wellbeing specialist. And I was working with organizations there to implement health and wellbeing solutions for their workforce, working with a wide variety, again, of clients, from banks, legal firms to large utility companies in a consultative capacity, but also trying to, for them to take up some of the services that we were partnering with. Unfortunately, we had to leave Australia and relocated to London at the beginning of 2018 after taking some time off to volunteer in Colombia, teaching disadvantaged children. So having a bit of a break away from the career for half a year. And since 2018, and since I'm in London, I'm working for Generali Employee Benefits Network as their head of global health and wellbeing programs.
All right. And what does that involve?
So we are a network of insurance companies across the world. So we're working with about 120 insurers in different business lines. So life, disability, and obviously also private medical insurance. And that's where I sit, where my responsibilities are. I am part of a dedicated team of experts on the medical insurance part, and we're working with medical insurers in about 60 countries and their multinational clients. Our team works in an advisory function with those multinational clients and local insurance partners. So I'm kind of the well-being person in a pool of insurance people, if you wish, maybe with a different agenda sometimes, but solely working with multinational clients there.
All right, that's great. It sounds like you're going to have some probably fairly unique perspective to share with us today.
I hope so too.
That multinational lens. So good
yeah,
stuff.
It's a long and winding road, that's for sure. And yeah, we won't go into the details about why you won't let back into the country. We're working in Australia.
Still allowed in the country. I just couldn't stay for longer.
We would have. Yeah, it's to our loss. We should have kept you.
Oh, thanks, Jason.
Well, we've had a number of discussions so far on the podcast in the first month about the need for health and safety and human resources to work together when it comes to psychological health and safety. And I believe, in some of your previous experiences, you've seen how this can work practically. Would you mind sharing with our listeners?
Well, unfortunately, this is not always happening. And there's a lot of different stakeholders in the organization that could benefit from talking to each other, from my experience. That would not only be HR and work health and safety, but also diversity and inclusion, learning and development, and benefits managers. And I do appreciate that it is difficult to bring all these different agendas together, and all these departments have their own targets for each year, and all have their own communication plans too. So it becomes pretty complex the bigger the companies are. I mentioned that I'm solely working with multinational clients, and the bigger the organizations become, the more specific the departments become in their agenda as well. The more countries they have entities in, the more complex it really becomes, and the more people you will need to engage with. So it is a task, right? But it's not unachievable. And it might look hard, but the thing is, for me personally, and what I believe is that all these departments work towards the same goal. They are all people departments, and they engage with the human at work. So a joint approach from like working in silos and only looking at your like piece of the puzzle would definitely be for the greater good of people, but that means also to have shared ownership of these topics and an understanding that they actually really all work like wanting to achieve the same things, which is engagement with the human at work. But also that means that if the human at work is engaged, and there's lots of studies that show that, it also means growth for the company itself. I always say that only healthy and safe companies are growing companies, and that's what I truly believe in. And I mean, as an example, you've asked for an example where I might have seen this happening well. And two examples come to mind. And one of them is, which is actually very related to the psych health and safety piece that we're talking about today. I was working with a legal firm in Australia, and I've seen the cooperation between HR, learning and development, and work health and safety work very nicely. The firm, unfortunately, had a very sad incident at work, and they started to address mental health from a risk perspective. So the project was sitting actually in the work health and safety department from that legal firm, which was the first time that I've personally seen it in my career that it was so specifically under the work health and safety hat. The project rollout was involving some learning and development programs, top down, bottom up, and across. So they had learning and development programs for executives, HR managers, work health and safety representatives. They educated their employees in mental health literacy. And they worked really, really closely with HR and learning and development to also integrate this learning for the future to everyone who was a new joiner. And everybody had to go through this training actually on a mandatory basis. So they made everyone take the training. It became part of the agenda of their learning and development program. And another thing they did, which I thought was very important too, another two things they did, was they educated a lot more mental health first aiders. And Jason, you and I had some conversations about that before. They started peer support groups to break down the barriers to access care. And I think that is a very important piece that we need to consider, that it's sometimes not enough to have executive buy-in. It's not enough to educate your HR team. It's not enough to have policies and procedures. There might still be barriers, and that's where you need the peer support team, because HR might not necessarily be where somebody wants to go to if they're struggling and have a mental health condition or going through a challenging time, because they might be afraid that it goes down into their file, you know? So I think that specifically was even though it was caused by a major incident, I think the legal industry, for the legal industry, it was a very thought leadership approach. The legal industry has a very low adoption rate for mental health services. It's like, just as an example, the EAP utilization rate lies below the average. The average is around 3% across the world, and I believe the legal industry has like 1.5 to 2%. So even lower than others. But due to the culture and the exposure to trauma and expectations in the industry, it has some of the highest needs for support. So this was a very fantastic approach to witness. Maybe also an example of my own personal work from actually very early in my career, from when I was still in Germany and working for the large-scale food service provider in 2012. They had a very strong and robust work health and safety system, which, due to the characteristics of the business and the nature of work, had very high importance. So it was every distribution center had their systems in place that was aligned with the work health and safety system. My role personally is set in the HR team, so the national HR team. However, we decided to attach everything well-being related to the work health and safety system. It just gave it a little bit more importance, and we were able to use the existing processes to roll out the project. We got executive buy-in for this approach that also freed up some budgets, because we know budgets are still an issue sometimes to get for these initiatives. But it also allowed us to utilize some of the government resources, such as the German work health and safety regulators. So we kind of were able to utilize those resources too. And what I did, and I think I can only recommend this for anyone who works in this field, is to actually go out and experience what the workers do face every day. So I went out and worked in shift with the warehouse pickers, and I loaded trucks, and I went out with the truck drivers to deliver in early mornings, because I wanted to truly understand their pain points. I wanted to have this anecdotal knowledge from them to understand where we can support them better. We should ask our employees where we can support them. And I just didn't want to be that person who sits in head office and believes to know what their issues are. I think that's a really important piece that I would probably recommend anyone who works in health and well-being to experience what they're going through, and to experience what they're exposed to in processes, in working processes. So as a result of that, it also exposed me to all distribution centers, and it made me known as the person who wants to be really involved. It was a whole lot of work, and it was a whole lot of effort, and I'm not a big fan of waking up at 2 a.m. in the morning and hop on a delivery truck, but it did give me that kind of exposure to the people that I needed to roll out my projects. And with that, well-being became part of safety briefings. We implemented targeted manual handling training for different work groups, such as pickers and truck drivers, but also sales, who are constantly sitting on their bum in cars and out on the road. We used the work health and safety representative to give us feedbacks about pain points. We did health and well-being check-ins in the morning briefings. We implemented coaching for managing work-life balance in shift work, so education about sleep hygiene, nutrition, movement, and all of this was aligned with the other HR activities around other benefits. So I think I was very lucky to be able to experience this approach firsthand, with being involved in that at a very early stage of corporate health and well-being in Germany. So I'm actually pretty happy about that.
Yeah, no, they are two really, really good examples, Daniela. One of the things that really struck me about that first example is the low EAP utilization rate.
Oh, yeah.
For so many companies, the EAP, I feel, is their first line of defense when it comes to employee mental health. But if the global average of utilization is 3%, and then you've got some industries like legal where it's 1.5%, well, obviously it can't be our first line of defense. We really need to look more at primary prevention rather than that tertiary prevention, which EAP often is focused on.
Absolutely. I agree. And I mean, obviously it does depend on the industry that you're looking at. Some of the industries that are more in caring capacities, like hospitals or care homes, they do have a larger uptake for EAP, but that's also because there's a lower barrier. It's also
are you saying, sorry, Daniela, are you saying that lawyers don't care?
Oh, no, I'm not saying that, obviously not. But I think it comes down to the culture of those businesses, right? And the communications about these services within the industry. So the law firms historically have a little bit of a very high demand and expected long working hours. They work on billable hours, right? Yep. So there is an expectation for just really like cracking on with your work, which I'm not saying that care industries don't do that, but the communications around getting help because they are in caring capacities is a different one. So the utilization in those industries is usually up to 10%, what I've seen in Australia particularly, because there's compassion fatigue and people are educated around boundaries and looking after themselves more than they are in other industries.
Yeah, true. No, that's a good observation. The other thing that really struck me as something that I completely have seen as well is that when we don't pull, say, health and wellbeing activities or mental health activities, as we talk about on this podcast, under health and safety, it is really hard to get that executive buy-in and the budget to actually do these things strategically. Too often, we get a keynote speaker in, or we do something that's kind of like a bit of icing on the cake, as Carlo Caponecchio would call it. And we don't really get to deal with these matters strategically, systematically, because we just don't have the resources or budget to do them properly. So it's really great to hear that example where once you can put it under the health and safety banner and get that exec buy-in, how you can actually have a much bigger impact on the health and wellbeing of workers.
Yep. Yeah, I totally agree. And budget is still a problem, I found it really interesting that suddenly with the pandemic, obviously there have been some savings on other areas of the business, especially here in the UK. The rise of requests in regards to support and suddenly available budget for these kind of initiatives was mind-blowing, I have to say. The amount of where conversations with clients, I was told that they're currently recruiting for dedicated roles in this space has been the highest I've ever seen.
Yeah, it's there's definitely been a lot of money being thrown around. It's just whether it's actually being spent in the right areas, I suppose.
That's right. Very true, Joelle. Very true.
So what are some of the conversations that you're having with your multinational clients around employee mental health at the moment?
Well, it really depends on who I'm talking to, which country I'm talking to, and I would probably say where the head office sits. So I'm usually talking to global HR or global benefits managers, and usually they sit in a country that has a higher adoption rate for health and well-being and specifically mental health services. They usually have a global agenda, and they have local programs as well. The local entities might address these kind of topics slightly differently. So just as an example, be reminded that we're working in the insurance industry, so we're working with local insurers, and when I look at the supplement, so the scope of cover is very different from country to country. So the UK or Australia benefit in the private medical insurance is very comprehensive. So there might be some additional services included that are unrelated to the pure insurance benefit. So they might have services such as EAP or some other preventative measures included in the premium. When we look at other countries such as, so they're also very expensive, those products, right? These insurance products are quite expensive, and organizations who pay for them, I know that's not very common in Australia, but it is in a lot of other countries that organizations pay for the private medical insurance for their employees. They easily spend like $200 a month for each employee for these private medical insurance. Is one of the highly regarded benefits to have in place when it comes to remuneration. When we go to countries like Thailand, for example, the scope of cover might be very different. So sometimes only hospitalization would be covered, and the benefit is that the premium is also a lot lower. So they might pay $200 for the whole year of premium. And according to that, or in line with that, I should say, the supplementary services locally are very different as well. And it really depends on the market that we're looking at. So the conversations that I have are always based around which country are we looking at? Supplementary local services provided by our network insurers in Europe and LATAM. Mental health coverage might be included. It's normally explicitly excluded in most countries. Support services are much more represented in those countries compared to the Asian region. And it really represents what the market requests. So a good example for that is probably the UK. In the UK, it is actually expected that employee assistance programs or mental health coverage is included in the plans. In other markets, that's simply not market practice. I do have to say that especially, so just keeping in mind that the adoption, I've been referring to the adoption quite a lot, and that is represented in the benefits that we're working with. So the insurance benefit and the inclusions of the benefit is represented in depending on the country that we're looking at. I have definitely seen over the last year that mental health specifically has definitely shifted more into focus. I think that it has pushed us well-being practitioner really forward in our agenda. And that's a great thing to see. I also think that public media has been very outspoken about mental health issues and the effect of the pandemic in everyone's health. At least that's what I've seen from here in the UK, the US, Canada, Australia. But that are the countries that are very outspoken about the topic anyways, and it's not as stigmatized as in other countries. We do have less information about other countries where this might still be a taboo topic, or adoption is less mature. As I mentioned, headquarters often sit in countries where the focus is already on mental health, and I've seen a shift towards a wish for a more centralized approach to services such as EAP, financial well-being, social well-being, etc. So I do get the impression that a lot of organizations still follow the idea, and I apologize if I'm a little bit provocative here. I do get the impression that they still believe that providing a phone number for the EAP provider on your internet website is enough, and that offering meditation apps is all they need to do to keep their people healthy. Don't get me wrong, that's all good. It's good that they do this. It's more than they did. But if someone's already struggling and going through a challenging time, and organizations say, let me know if we can do something for you, and here is a number to call, that might be overwhelming for the person that is going through the hard time. They need to be asked what they need to be able to fulfill their role while they're struggling, whether they need some time off, but they also need guidance on how to access help. It's also pushing the responsibility back to the employee and the ownership away from the organization. And I think we really need an approach towards, or we need a shift towards an approach that really shares the ownership for any kind of health and well-being initiatives, whether it's physical or mental well-being. I also get the vibe that we still need to do some work about destigmatizing the topic in general. And I'm not only talking about the social stigma, but also the self-stigma around mental health. Most people are fine with other people getting help for their mental health and concerns, but not for themselves. It's okay for other people to call the EAP, but it's not okay to openly speak about the fact that you have used up all your sessions for the year, right? So there is still this self-stigma around the topic as well, that everybody's like, yes, we need to talk about mental health, but when it comes down to you talk about your mental health, that's where the conversation ends. So those are the topics that I kind of get out of the conversations, that we do definitely need to still destigmatize, and we still do need to help some countries that have a lower adoption rate. And we still need to normalize the topics and share the ownership for the topic.
Lots of information there, Danny, but I wouldn't say that that perspective is overly provocative or out of line with the perspective that most of our guests have shared in relation to that. You know, we can't just give people an EAP and an exercise program or a meditation app and think that we're finished. No, absolutely not. So we're all in violent agreement on that topic.
Violent agreement. That's a good expression.
And we have seen, you know, it can be quite patronizing when you're saying, you know, yes, we expect you to work 14 hours a day, but here's a mindfulness app, or here's the phone number for the EAP. I remember reading a study that was conducted during the height of the pandemic in Victoria, where they surveyed, I think, 10,000 healthcare workers. And, you know, they said, oh, yeah, we got given a mindfulness app. But what we really want is for like leadership to listen to us and understand what we're going through and actually put in things that actually deal with the root causes of our greatest sources of angst. Mindfulness isn't going to fix this situation. Yes, the pandemic's hard on everyone, particularly our healthcare workers who are on the front line. So don't think you can just get off lightly as an employer by saying, here's an app. We actually need systemic approaches, and that definitely came out of that survey. So it's really interesting and heartening to hear that, you know, people are asking for these kind of approaches, and, you know, they can see through the things like the pretty apps and that sort of thing that actually don't really solve the problem of workplace mental health.
Yeah, I agree. I think employees do understand that as like an organizational change has to happen, like in the way we treat people, not only top down, but also across. Like there needs to be education around working less in silos and working as teams and really being human at work. It sounds like the basics, but it is what it is. Like we need to be human at work. And I think that's oftentimes lacking because organizations do feel like there's a trade-off, right? If you do change processes and procedures, that will affect your bottom line, but it's not a trade-off. We do all know, or those who work in this space, that there's a lot of studies that show that more engaged people at work are more productive. So investing in these services do have an effect on productivity. And it's hard, you know, it's a big task for organizations to say, oh, we're changing our policies, we're changing the way we work. Just taking that example of the legal firm, they work on billable hours. If they did anything shifting, the first thing that they're going to see or the first thing that they're going to be afraid of is that they can't bill as many hours anymore, right? But investing in the people and changing the way we work and bringing policies and culture change will have a positive effect in productivity overall. And but I do get that organizations are scared of that. It's harder to measure these kind of these factors. It's hard to measure whether you've changed somebody's lives, whether you prevented a mental illness. That's hard to measure. It's easier to measure revenue and profit, right? So
yeah, absolutely. And we're definitely speaking the same language there. You know, the investment that you make in your people is generally repaid in multiples, right? When it comes to productivity and performance, as well as culture and, you know, people staying with the company for longer and whatnot. So it'll be interesting to see with things like the ISO standard coming up, how many companies go, well, this is a bit of a shift to how we normally do things, and you know, putting health and mental health under the health and safety management system is going to be interesting. So on that, there's a bit of a segue to that actually, with ISO 45003. Has that come up in conversations that you've had with multinationals yet?
Yeah, definitely. So we have had conversations. I mean, there have been other examples before that have come up in conversations, like the National Standard of Canada for Psychological Health and Safety in the Workplace is obviously one that is often referred to. I do believe that overall there is more education needed. They need to understand the contents more. They need to understand sometimes what psychological hazards are. I think once you explain what it is, and you mentioned like autonomy and control and role clarity and organizational justice, they do understand what you're talking about. They just haven't approached it from that kind of perspective yet. I do believe that it's something that they should aspire to align with. I do believe that it is something that they should think about, even if it's just as a framework to understand what they might want to look at in their process. You don't want it to become a like ticker box kind of situation, but really something that is implemented correctly with the right policies and procedures in place. But what has become very clear, especially in my role, as I mentioned, I often talk to employee benefits managers or health HR, human resources managers. It becomes very clear that you need to have the right people on the table to talk about this. Mental health often sits within HR or benefits. The ISO standards obviously refer to work health and safety. And these, as I mentioned earlier, these departments sometimes don't talk to each other. So the idea of using a work health and safety framework for something that is historically either the individual's responsibilities or HR responsibilities is a new concept for them, right? So a work health and safety department itself might think, oh, well, mental health is HR. I don't have anything to do with it. But obviously there is a lot of work health and safety people already out there who do appreciate that. You just need to talk to them, to get in front of them. And in my role, this is sometimes, I have to say, a challenge because I do need to get in front of them. I normally don't speak to work health and safety in my role. But yeah, I do think that it is something that organizations should aspire to. We do share the responsibilities, or organizations share the responsibility. They do look after the physical risks, and they provide a work environment that supports the physical health of their employees by giving them tools and desks and screens and whatnot. But I think the shared responsibility to look at the work environment that should not risk mental health is a concept that is still fairly new.
Yeah. Now, I tend to believe that it's going to take at least 3 to 5 years to see more wider adoption of the standard once it's released. But I guess the beauty of working with multinationals, as you do, is that many of them would have adopted the international standard for occupational health and safety management systems, the parent standard 45001. And so hopefully that helps with their at least desire to begin implementing 45003 once it's released.
Yeah, absolutely. But again, I mean, the important thing for me in the conversations is that you don't want to just tick boxes. You don't just want to align with for the sake of aligning. You actually want to do the work. And I think that is, then it maybe becomes a little bit more selective, because you have to keep in mind what industry you're working with, in what kind of like overall company targets you're following. So yeah, but I agree, it will be a process. But we're I have to say, even though it's horrible that we're going through the pandemic, but in a way, the pandemic has evened out the path for these approaches, because suddenly health and well-being has moved much more into focus.
Yeah, I think it definitely has advanced our agenda around mental health in the workplace a good 3 to 5 years, the pandemic. So if anything, that's hopefully a good thing to come out of it. And I know Peter Kelly, who you now know as well, out of Liverpool, who was on episode 3, did say that they're copping a bit of heat to try and get this standard out sooner rather than later, given the increased emphasis on mental health and the need to take more of a systemic approach to how we deal with this in workplaces.
So data. Let's talk about data and how important that is for multinationals.
I love data.
You do love data, yes. It's a bit creepy, really.
Yeah, sorry.
We won't go down that path.
I shouldn't say it that way.
So if you're a multinational and you're wanting to get good data across your different regions of the world, and depending on, I guess, where those regions are, you've talked about, some areas of the world that are potentially, not as advanced in the mental health space. What are some of the indicators that are useful for multinationals to refer to?
So again, I guess it comes back down to the cooperative works between departments, because the data can come, if you want to get a very good view and on what is happening, you want to involve the data of different departments across the organizations, and then obviously different departments and different entities around the world. So obviously the most obvious are data from EAP reports, what's the utilization, data from employee engagement surveys, absenteeism data, pulse surveys on well-being. I've seen a lot of companies doing pulse surveys during the remote working environment. You could look into completion of well-being training. If you have additional like health apps that you provide to your employees, they might provide additional insights. Obviously, you also want to look at disability and medical claims. And work health and safety data. If mental health is part of their risk assessment, then obviously that is a good thing to look at, and their incidence reports. But talking about the medical claims data, I mentioned earlier in the conversation that mental health is explicitly excluded in most private medical insurances around the world. So we're very lucky in Australia, or I'm in the UK, that mental health treatment is actually covered by my private medical insurance. It's mostly, it's not that other countries or insurers in other countries can't administer that kind of treatment. It's just not purchased in the market. It's not market practice to have mental health cover in there. So when you request medical claims data, which is the data that I'm mostly working with, it's not necessarily telling you much, because it's simply not covered. Like, you will not get any information from all the F codes, like in the ICD-10. The F codes are for mental and behavioral symptoms. You just won't get them because they're not covered. What we have done over the past year, we provide global medical dashboards for our multinational clients, where we try to analyze trends and cost drivers from across the world, so they can see in an interactive and same format how their medical claims experience compares from Spain to Thailand to Canada to, I don't know, the UK. And we analyze the trends and cost drivers, and then also come to mitigation ideas. So what can they do about these? What can they do about these trends and cost drivers? But as I mentioned, we don't see any claims for mental health issues. Oftentimes the national healthcare systems are simply deemed responsible to cover the care for this. But we thought, as we know at JEB, that multinational clients have a big interest in mental health, the mental health of their people. We've decided that we want to work on creating a window into potentially underlying psychological issues from medical claims for physical illnesses. So I worked with the medical team, our medical team in Canada from our sister company, to create a list of ICD-10 codes that show high, moderate, or low risk of comorbidities. So as an example, for diseases that are caused or exacerbated by poor mental health, or vice versa, would be if somebody is diagnosed with a serious illness like cancer, there's a high risk of developing some mental health issues. If somebody is exposed to stress over an extended period of time, we do know that this can cause cardiovascular diseases. If somebody has skin conditions such as psoriasis, and they are exposed to pressure, stress, or are mentally unwell, these can flare up. So we have tried to put that into our dashboard and show whether these ICD-10s are rising in line, above or beyond the average. And if they are rising above the average, then there might be some things that the organization might want to address in regards to mental health. We can also differentiate between dependents and employees. So that's obviously very interesting if you particularly see a rise for employees for these physical illnesses that might have comorbidities with mental illnesses. Then the data suggests that there might be issues and the company might want to address them. So it's been a very exciting project to work on, and also oftentimes it is also an issue that the issue is that the coding from the doctor, they are first diagnosed with a physical illness, and later on in the treatment it is discovered that it was actually caused by a mental illness, but the ICD-10 code in the system is not changed anymore. So it's been a very exciting thing to work on, very powerful as well, to talk with organizations about it, to try and show this relationship between physical and mental illness in the data.
Yeah, that's really fascinating. Using, because you don't have access into that window to actually look at mental health claims to say, all right, well, what do we know about correlations with physical health claims, and what can we then infer or hypothesize from the data that we can actually see? Yeah, that's a fascinating approach.
Yeah, no, it's amazing work that you and your team are doing, Daniela. So thinking about the future, you've seen a lot obviously transpire over your experience to date. What would your hopes be for mental health in the workplace moving forward?
Well, my biggest hope is that organizations and society don't make a difference between mental and physical health anymore, that it becomes widely accepted to speak about mental health as we speak about our physical health. It seems to be okay to break your arm and take time off for that, but it still seems like there's shame attached to it. And I'm really sorry for the weak analogy that doesn't really cover the complexity of the issues, but breaking your heart, openly discussing that taking time to rest and recover is still attached with shame. And I think we really need to work on that. I also think Jason and we had some conversations about this. We need to tidy up language we use around mental health. It sounds like basics, but it is still an issue in many conversations that I have, that mental health is used equivalent to mental illness and stress the same way as mental health conditions. So I do believe there's still some work to be done so everybody knows the right terms to use. I also think, and I mentioned that earlier, is that we get more for mental health first aiders in companies, and that they get the same importance as first aiders and fire wardens, for example, from a work health and safety perspective. I hope that senior managers speak up about their own experience with poor mental health and show positive behavior modeling. I think that is a very important thing that I can just put out there. Normalize taking lunch breaks, normalize to go to the gym during the day, speak about challenging times, be a human at work, no matter which level you're working on. The most powerful implementations of programs I've seen where CEOs spoke up about their own experience with mental illness, talking about their own anxiety or depression. Those were the most powerful implementations that I've seen. And I also hope that organizations listen when their people speak up. I do hope that individuals find the courage to share their stories, that they show up for peer support, raising awareness for a topic that still in 2021 is not normalized enough, in my opinion.
Yeah, that's a grand vision, Daniela. And I think that would go a long way to moving the needle in relation to the mental health in the workplace.
So thinking about that vision then, do you have some parting words that you'd like to share with practitioners who are hoping to work in this area of psychological health and safety?
So on a professional level, I would say challenge what is there and challenge what is not there. Be the provocative voice at the table. very important. This was what we've been raising a few times. Talk to other departments and think outside your area. Also for processes that you might be able to use for the rollout of your initiative. And be honest about that. Be honest about whether you're working in silos and whether you're pushing ownership away for certain topics. I think that's an important thing. And be an example for this positive behavior modeling. Do the work yourself, have the courage to be human, share your experience about challenging times that you might have gone through. I think that those are the things that I would say show up. That's the big thing. And on a personal level, and I think that is an important one to mention as well, be mindful with your own resources. Most of us who work in this field are very passionate about the subject, and that can sometimes make setting boundaries a little bit difficult. So I would say to everyone who aspires to work in this field or is already working in this field, be that positive behavior modeler for yourself as well. So, look after yourself.
Some excellent advice there, Dani, and I think probably echoing some of the advice that we've heard from other people, other guests that we've had in the past. So you've got some good support there in your advice.
Yeah, and even from what you're mentioning before, Daniela, about your own experience, actually getting down on the ground level with the employees who do the work, even if you have to get up at 2 a.m., and understanding it from their perspective. I think that's so important. Like you say, you can be sitting in your ivory tower and think you have a good understanding about the employee experience. But until you get down there and you're picking in a warehouse with them, you're not going to understand it.
There's nothing like being in 50-degree heat and red dirt with a camelback on your back and, hard hat and long sleeves with that wind blowing in from the desert to just really help you appreciate what fatigue.
Yeah, we don't get that in the UK,
No, not in the UK.
Yeah. Well, Daniela, it's been fantastic chatting with you. Where could our listeners find out more about the Generali Employee Benefits Network and the awesome work that you're doing?
Oh, well, you can just hop online and search for Generali Employee Benefits Network or www.jep.com. And you will find on the website that there's a dedicated area which is called Health. And that is all the work that our department does.
Yeah, fantastic. Thank you so much. Well, that's it for today then, listeners. Thanks again to Daniela for joining us and just giving us so much experience of and understanding of really how multinationals can tackle mental health in the workplace. Don't forget, we do record these sessions via the Zoom conversations that we have, and you can check out those videos on the Flourish GX YouTube channel. Also, Joelle and I are way too active on LinkedIn, and so if you follow us or connect with us, we'll probably reply almost instantly. You'll be very amazed at how...
Just continue to enable us,
yeah.
please.
It is our guilty pleasure, but we do love mixing with like-minded professionals. And yeah, you can follow Jeb and follow Daniela definitely on LinkedIn as well. So thanks very much, listeners, and we'll catch you next episode.